Yeah, so I'm delighted to introduce Jess Radley. So she's a fourth year PhD student at the University of Oxford, and her thesis has examined the needs and experiences of parents with psychosis and their families. So she's used a mixed methods approach. So she started with qualitative interviews with parents with psychosis and also with their children and other family members. And she also conducted focus groups with mental health professionals working with these families. And she presented these results at the conference we had in Cardiff. And she's also analysed quantitative data from NHS Trust electronic health records to examine the frequency of parenthood in patients with psychosis and then the associated characteristics and risk of relapse in this group. And then she presented these results last year. She's also done 2 systematic reviews, a Cochrane review and a broader scoping review. And then the qualitative study led to the design of an experience sampling methodology study to look at the relationship between parenting stress and psychotic symptoms. And Jess is presenting those results today. So just to say, I mean, Jess has worked extremely hard during her PhD. She submitted 8 research papers, 6 of which are published or accepted already, 2 under review. She's been committed to open science, publishing things on the Open Science Framework, a registered report, and to patient involvement throughout her studies, done some excellent PPI, particularly with this study. It's been an absolute pleasure to supervise her. She'll be submitting in July her thesis and then starting clinical psychology training in the autumn, and hopes to pursue a clinical academic career. So I'll hand over to Jess.
Thank you very much, Louise. Yes, so as Louise has said, my PhD has been looking at the needs and experiences of parents with psychosis. And I've done that with 4 main areas of research. So a secondary data analysis of parent characteristics. So what makes you more likely to be a parent when you have psychosis? Some qualitative interviews and focus groups with the parents themselves, with their partners, with children, with mental health professionals who've worked with parents with psychosis. Now I've conducted some systematic reviews of interventions to actually think, what's out there to help these parents and what more do we need to do to develop good interventions. But today I'm presenting the results from an intensive longitudinal assessment of stress and psychosis. I'll just present that now. So we know that stress plays an important role in the development and the maintenance of psychotic symptoms. And there's a stress vulnerability hypothesis of psychosis, and often you can use this bucket analogy. So we all have different vulnerability to psychosis due to genetics and early life experiences, and some people have a much smaller bucket. And so the water in the bucket is stress. So some people need less stress for their bucket to overflow into psychosis, but some people who don't even have much vulnerability may experience lots of stress throughout life and still experience psychosis. So that's quite a key hypothesis in the field of psychosis. We also know that the pathway from stress to psychosis may be through something called negative affect, but I'll just be using the term low mood today. So it might be that stress leads to low mood, which then leads to psychosis. And finally, thinking about my research, well, we also know that parenting is a really stressful job. And so I want to investigate what's the relationship between stress and psychosis like in parents, or specifically stress due to parenting. So I had 3 hypotheses. First of all, that stress due to parenting will increase psychosis, and that will be mediated by low mood, which has been found in the literature before. Secondly, that the factors in this box will all improve the model's estimation. So parents' levels of social support, their levels of coping, their perception of their child's behavior and their own self-efficacy will influence this relationship between stress and psychosis. And then finally, that stress specific to parenting, so stress due to parenting, will have a larger impact on psychosis than stress in general for these parents. So the eligibility criteria was that they had to have a diagnosis of psychotic disorder, but excluding ones where the cause would be non-stress related, so things like postpartum or drug-induced or organic. They had to be a parent of a child between the ages of 2 and 16, and they had to live with their child so that we could measure parenting stress. And a power analysis returned that we needed to recruit 32 participants. So we used experience sampling methodology as a design, which is a type of intensive longitudinal sampling of participants, where you give them the same survey multiple times over a short time period. So the advantage of this is that you get multiple measurements, and in particular, it's good for factors that change often. So mood changes often. So if you measure someone's mood at one time point, you might not be getting the full picture of their mood in general. And you often ask people to take a study phone home, or they install an app on their own phone. So another advantage is that you're measuring them in a natural setting rather than a lab-based environment. So that's what we did. We asked participants to take a study phone home that only had one app on it, which was this app that would sample them, and it would beep several times a day. So it beeped 6 times a day over 10 days. And when it beeped, these 20 questions would pop up. This is kind of what it looked like. So I feel lonely was a type of low mood question. So they'd get the question on their phone, I feel lonely. And they would swipe between 0 and 100 to indicate how much they agreed with that. Those are our time varying questions, our experience sampling methodology questions, which we imagined their answer would change throughout the study. And then we had these time invariant questions, so things like demographics, or those items I measured earlier, so social support and coping. And we measured them at one time point, so at the beginning of the study. And statistical analysis, for those who are interested, is called multi-level regression, because you have these multiple time points and you need to group them within people. And also to say that had some public and patient involvement in the study. It was quite important because it's a slightly invasive study. They're taking phones home and it's beeping all the time. So I really wanted to, I gave people, we had a day in Oxford, we invited 4 parents with psychosis to try out the mobile phones. We talked about some of the questions that would pop up, and they gave me some great advice and great ways to change the study. So things like, don't phrase everything negatively. Don't have every question like, I feel sad, I feel lonely. You can phrase some questions positively and then reverse code it later. Or, don't beat me at certain times of the day. And I wouldn't know that because I'm not a parent myself. So it was really useful to get that input. So onto the results. So characteristics. So we actually ended up recruiting 35 people. Most parents in the sample were mothers, most people were female. Most people were white British, probably because we're recruiting from Oxfordshire. Most people were married or had ever been married, but 7 people in the sample were single. Average age was 41. Most people had their first psychotic episode at 36, 37, which is actually quite late, which is interesting. And the number of children on average was about 2.4, slightly higher than the national average. And just for interest, here's a kind of a snapshot of 10 participants' psychosis scores throughout the study. So you can see along the bottom here, you have the 60 observations because we sampled them 6 times a day for 10 days. And up here is the psychosis scores. So you can see for some people, they reported quite high levels of psychosis, like the number 32. With participant 2 and 4, they reported quite low levels. Some people had much more variability, like in 32, but some people were a bit flatter, like in 4, so not much change between his or her scores. You can see participant 34 had a bit of a trajectory throughout it. So they started fairly high and that kind of leveled off throughout the study. And some people recorded lots of beeps, like number 4, number 22, or some people recorded fewer, so number 28, seemingly only recorded about maybe above 20 beeps. And if they recorded fewer than 20 beeps, they were excluded from the sample, and that only happened from the analysis, and that only happened to one person. So the first hypothesis, so stress due to parenting will increase psychosis, and that being mediated through low mood. So the model did seem to be the case. Just to visually represent that, you can see the positive relationship between parenting stress and psychosis. And looking at low mood as a mediator, so this top line, the causal mediation effect, which is these solid red arrows, that was highly significant, the causal effect. And it was so significant that actually the direct effect, this kind of shaded red arrow here, became non-significant. So it implied that actually the relationship between stress and psychosis was being fully mediated by low mood. And then just showing you the same graph now, but colored by low mood, you can kind of see that. So people with the highest scores of low mood did have very high levels of psychosis. And then those with less low mood are down here in blue. So you can kind of see that relationship visually. And this was the final model. We also included participants' mean level of stress and their mean low mood throughout the study. So that is, we have up to 60 beeps per participant. So we take their average of stress and low mood that they experienced at the whole study and put those in the model too. And those were also highly significant in a positive direction, showing that the more stress they experienced in general, the more low mood they experienced in general led to more psychosis. And age and gender weren't significant in the modelling of the relationship between stress and psychosis. So in the second hypothesis, so we added in these 4 factors, and it just didn't seem to be any significant effect there. We also investigated them not just as covariates, but as moderators, and there was some relationships there, but I don't really have time to talk about it now. But yeah, it is interesting that there wasn't much improvement in the model estimation. And then the third hypothesis, that stress due to parenting will have a large impact on psychosis and general stress. I'll first just briefly touch upon how we measure stress. So we asked them what they're doing right now. And one option was parenting activity, and they had all the other things they could tick. And then we asked them, we got the amount of stress question, the stress score. So we said, I'd rather do something else that's difficult for me, or I can do this well. So you reverse code, I can do this well, and then take an average of these 3. So we classified parenting stress, or stress due to parenting, as any time they'd clicked parenting activity and then their stress score. And other related parenting was times they hadn't clicked parenting activity, they clicked something else. So that actually was a significant effect of type of stress, but not in the direction we thought. And it's very subtle, but you can see here that actually the other related stress line is just slightly steeper than the parenting stress line, just slightly. And that was significant in the modeling. So we didn't find that parenting stress did have a stronger relationship between stress and psychosis than other related stress. It was actually the opposite effect, but not in a major way. So to conclude, parenting stress does exacerbate psychotic symptoms. So adding to the literature between stress and psychosis, parenting stress is important. Just thinking about parents with psychosis in particular, people often think about, well, when you have psychosis, how does that impact on your parenting? How does that impact on your children? But we also need to think about the other direction. Parenting is really stressful. How does that impact on actually their mental health and how they're experiencing symptoms and how they can manage them? So I think it's really important to think about both these directions. Then again, we've confirmed that low mood is a really important mediator of this relationship. And finally, we didn't confirm that parenting stress was more impactful than other types of stress, but I really wonder whether it was possible to disentangle stress due to parenting. I mean, if you're a parent, then actually, work stress might be related to parenting too, because you might have less time to work, you might have to leave work early for certain reasons. So I think actually to really disentangle the effects of parenting stress, it'd be better to compare it to a group of non-parents with psychosis. Okay, so I'll wrap up. So just because I am about to hand in, I just want to highlight the publications, and this one at the top is related to this study. And as Louise said, I had it accepted as a registered report, which I was really pleased by, because they said as long as I collect the data, I had that done before I collected the data. So they said as long as I do exactly what I said I'd do, they published the results, no matter if it was a positive or a negative finding. And then I want to thank Mental Health Research UK for supporting me to go to the SIRS conference last week or 2 weeks ago, where I presented a poster. And then just thank you to my supervisors.
Brilliant. Thank you very much. Lovely and clear. Any comments or questions? Elvira.
Hello. Well done for all your papers and for this very interesting presentation. This is a very under-researched topic. It's really very exciting to hear. Sorry if you mentioned this already. I was wondering if you had looked at any treatment effects on your associations and on your modeling, both psychological and medication treatments, because of course a lot of patients get given treatments precisely for low mood that might perhaps modify these associations.
No, I didn't look at any treatment effects, actually. I can't really offer much insight into that question, but it's a very interesting question. And of course, it's going to have an impact. So yeah, I mean, it's definitely a field of work that'd be important to look into. But it kind of branched off from my thesis, which is what are the needs and experiences of psychosis. So it came out of this qualitative study where parents were saying some mothers, I almost had this hypothesis that some mothers developed psychosis so late in the sample, and particularly had children with really difficult behavioural needs like ADHD or ASD. And part of me was thinking, like, well, was parenting so stressful that it actually almost contributed to the development of psychosis in the first place? So that's why I really wanted to measure this relationship between stress and psychosis in parents with all these additional factors. So that's kind of where I came from with this idea. But looking at treatment effects would also be really, really interesting, particularly with low mood, like you said, to see if reducing that, did that reduce the levels of psychosis as well, if you kind of tackle that pathway? Yeah.
It's another PhD altogether.
Probably another PhD. Yeah.
This question about the specificity of parenting stress, if it is specific, might be something that you could get the views of parents themselves.
Yeah.
I mean, my recollection, and remember I was a father, not a mother, is that the whole life becomes quite stressful at times. And I'm not sure I could have parsed out specific aspects.
Yeah, no, I really agree. I think that's a good conclusion. And so the great thing is, so Louise said, us really into open science. All of the data is going on the open science framework. And I've been talking to someone at Manchester as well about, you don't need to recruit a group of, you don't need to rerun the study, you just need to recruit a group of non-parents with psychosis, do the same study, and then you can compare the results. So hopefully the results from my study will be able to be compared to other groups. And I think that'd be better of disentangling the effects. So you've got two groups of people with psychosis, one have this job of parenting and one don't. Then what are the differences? What's the group effect? I think
That would be very neat.
Yeah.
And it's really nice to see you using the pre-registration system again, another example. That's lovely.
Yeah. And it's great, and it's really important to think about it earlier on in your career, because it's a bit tricky to work your way through. And also, if you want to pre-register a study, you have to have the ethics approval in place. You have to have your introduction, your methods done and accepted before you can even start the study. So you have to front load it in your PhD. Yeah, but I mean, I think
it's tough but worthwhile.
exactly.
Okay, well done.